So basically, now moving towards the Kaposi sarcoma, which is actually a malignant neoplasm, originate from the endothelial cells of the blood capillaries. Common sarcoma is basically of angiomatous tissues, means of the blood vessels. Slow growing behavior is aggressive with rapid visceral involvement. Okay, causes immunodeficient patient, means an HIV patient can have genetic factors, can also be. Then we have actually environmental factors also. Then it is infection by HIV or cytomegalovirus, that it can also be. Okay, age is basically 57 decade, more common in males actually. Head, neck region and tips of nose. Differential diagnosis is oral pulpura, bacillary angiomatosis, pyogenic granuloma. Different. Okay, now moving towards the three different stages of actually. One is patch stage, then another is also patch. In patch stage, what happened? It is pink, red, purple macules. Okay, means pink, red, purple macules over the oral mucosa. And with the time, these plaques becomes large, raised, voluminous plaques. So first it was red, purple, red, purple, and pink. Then it fuse and give rise to the voluminous plaques. Moving towards actually nodular stage. In nodular stage, what happened? Last occurrence of multiple nodular lesions on the skin. In last, there are multiple nodules on the skin or oral mucosa. Oral manifestation is basically is hard palate, most common site. First symptom is basically of AIDS, appear alone in or association with the skin or disseminated lesions. Okay, hard palate, which is the most common site, and also with the disseminated lesions. That okay, vary in size from a few millimeters to centimeter or more in diameter, tender, painful, appear red, blue, purplish region, which is flat, rise, solitary or multiple. So the lesion is basically like purple blue. It has a raised, it is raised, flat, but a little bit raised, solitary, alone, and multiple. Okay, treatment is actually for these large lesions is because local treatment is appropriate for these large lesions because it interfere with your eating and talking. Local application of sclerosing agents reduce the size. Surgically, what do? We remove these lesions as gingival or tongue lesion, and also on carbon dioxide laser. Radiotherapy, large multiple lesions also can be, which is 800. Okay, now how you assess the staging of HIV. Very important. Staging is important for selecting the patients for the treatment and assessing the progress. Okay, so first of all, it is actually CD4 plus cells or per mule, means total lymphocytes count per ml clinical category. Okay, then basically it has been divided in that area. So but first of all, it was actually more than 500 CD4 cells, more than 2000 lymphocytes. So it was A1, B1 and C1. When it less than 200 or 500 CD4 cells, or total lymphocytes were less than like it was between 1000 and 2000. It is A2, B2 and C2. More less than 200 more than 1000 less than 1000, it is basically A3, B3 and C3. Okay, now basically